Hi, everyone, and welcome to this webinar, whether you are here with us live in the Zoom room or whether you're listening on some other platform, such as the Pain Science Education podcast or maybe on our YouTube channel. We're excited to speak with you today, both Dr. Rose Pignataro and myself, Joe Tatta. I'm going to share my screen. We're going to probably present for just about 40 minutes on the topic of nutrition for chronic pain and the health behavior change, right? That's required to adhere to things like nutritional changes and different patterns of healthy eating. So I'm going to get us started today. I'll probably speak for just about 10 minutes or so. Then I'm going to turn the webinar controls over to Dr. Pignataro, who's going to speak about enhancing motivation and how important that is in health behavior change. And then we're going to kind of wrap up. We'll have some time for Q&A as well. Okay, so the title of today's webinar is Help Your Patients Achieve Nutrition Goals to Manage Pain. So we know that nutrition is an evidence-based way to help reduce and maybe even eliminate chronic pain in some people. And just here are learning objectives for this webinar. So first, to identify the link between nutrition and pain, excuse me, and how evidence-based dietary changes can reduce inflammation and improve pain outcomes in people with chronic pain. To describe the barriers to adhering to nutrition, right? We know that nutrition is important, yet people need a little bit of help to adhere to the advice that we're providing them. And then finally, how to apply some basic motivational techniques, right? So we want to give you some skills that you can take away and bring back to your practice maybe on Monday to help people sustain nutrition changes so that they can obviously alleviate their pain and improve their health and well-being. Let's just start with the evidence, right? So we are obviously licensed health professionals, we are licensed physical therapists, and it's important that we take an evidence-based lens to everything that we do. I'm going to put kind of front and center two papers that I was a part of, groups of teams of physical therapists and nutrition professionals. The first one is using nutrition as an intervention to target central nervous system sensitization, right? So that term, nervous system sensitization, probably isn't new for many of you. If it is, much of the research around a mechanism of chronic pain, if you will, is that the nervous system becomes sensitized. And we know that nutrition is an evidence-based way to reduce central nervous system sensitization. I was part of the team that wrote this whole paper on that, so that's out there for you. This one is behind a paywall. If you'd like, you can email me and I'm happy to share it with you. The next one in 2022, which I wrote specifically for physical therapists, but this applies to really every health and wellness provider, is that all of us should be talking about and using nutrition in some way in our patients with chronic pain, right? So this was kind of a really more of a call to action that I presented to our main journal, the Journal of the American Physical Therapy Association, saying, hey, this is so important that we really should be talking about this in practice. And there's lots of good information in this paper about not only the mechanisms, right, the cause of chronic pain as it refers to nutrition, but also different types of dietary approaches or healthy eating patterns are all listed in this paper. We did a systematic review where we looked at things like Mediterranean diets and elimination diets and paleo diets and keto diets. All that is wrapped up in this paper. I'm going to really pull really from these two papers today as I go through a couple of slides. Now, I like to make things easy because I've written these papers. The papers are really deep, right? They're deep science. And as providers, we love that deep science. But it's also really good to make things approachable, not only for us, right? We need that. We need things to be easy for us as providers as well, but our patients and clients need things to be easy as well. So people often ask me, well, if I change my pattern of eating, right, to be a healthier way of eating, how does that exactly alleviate pain? So, first is, well, when you shift to a healthy pattern of eating, it optimizes your nutrition. That's first. Second, healthy patterns of eating have an impact or have an effect on nociception, right? Nociception is that signal that travels through our nervous system and eventually lands in the brain, and then our brain decides what to do with that. Nutrition has an impact, or healthy patterns of eating have an impact on our microbiome. There's a plethora of information now around the microbiome and pain. I'm going to share that with you in a couple of moments. And then finally, healthy patterns of eating have an impact on our brain and cognitive function, right? Our psychology, if you will. So let me kind of go through these 4 points right here, really important. Let's just start with the first one with nutrition. We know that chronic inflammation is one of the root causes of every single disease known to man on the planet. And there are bidirectional associations between many of those chronic diseases and many of the chronic pain syndromes that we see. So, for example, the top one there was published in October of 2017 in the Journal of Physical Medicine and Rehabilitation, where they basically said, hey, there's a bidirectional association between metabolic syndrome and osteoarthritis. So when people have poor nutrition habits, they're likely to develop metabolic syndrome. And then from that, they develop osteoarthritis. But it actually works the other way around too, that when you have poor nutrition habits, you may develop osteoarthritis, which decreases things like your movement, which may also then lead to metabolic syndrome. Now, I don't have time, obviously, today. It would be a very long webinar if I had to go through every single condition, but many of the chronic inflammatory conditions, including autoimmune diseases, including osteoarthritis, have bidirectional associations with the quality of nutrition, right? The quality of our diet. So 2 really good resources for you there. Now, healthy patterns of eating have an impact on nociception. So this is an image I pulled from the study that's there on the right, right? Does human diet have a role in reducing nociception and inflammation related to chronic pain? And the answer is yes. Both Western foods as well as Eastern foods or patterns of eating, when you stick to kind of these whole food, plant-based diets, that there are specific anti-nociceptive nutrients. So there are nutrients that can block the nociceptive signal. And what's fun about this is we can, as providers, we can have fun with this and say, hey, what foods do you really enjoy eating? What tastes good to you? What foods are part of your cultural heritage and diet that you love to eat, right? So no matter who your patient is, you can find foods, both on the Western side as well as on the Eastern side, specific foods that are anti-nociceptive. They're anti-inflammatory. They block pain, essentially, right? They block the signals. Fourth, we mentioned the microbiome, right? There's a plethora of information now around the role of the human microbiome in every chronic disease, but there's been probably in the last maybe 5 to 7 years an increase in the amount of studies we're seeing on how the microbiome has an effect on pain processing. We now know that people with fibromyalgia have distinct changes in their microbiome composition that leads to increased pain sensitivity and systemic inflammation. Rheumatoid arthritis, we're starting to see like certain conditions have actually certain dysbiotic patterns to them. So RA is one, and when there's an increase in Prevotella copri, it leads to more autoimmune inflammation, obviously joint pain. There are changes in what's known as the gut joint axis. So there's a specific microbiome that's actually involved in your joint, actually, and has an impact on inflammation in your joint and the metabolism, right? What's happening in your joint and how that affects your cartilage. And then finally, we're seeing changes in the gut microbiome with things like low back pain and how that relates to neuroinflammation, right? Inflammation in the nervous system. And we know that when there's that inflammation in the nervous system, it has an effect on pain processing. And then finally, our brain, right? So there's a connection between our gut and our brain. There's actually 5 very important connections between our microbiome and our brain, right? So you have this neural network You've all heard of the vagus nerve. The vagus nerve travels from the gut up to your brain. And with that, it can change the flow of different neuroendocrine signals. In your gut, there's also an immune system. So with poor patterns of eating, you change the immune composition of your gut, which communicates with your brain. And realize that many of these things can actually pass the blood-brain barrier, right? It's not just alcohol that passes through the blood-brain barrier, but there are many neuroendocrine hormone-based receptors or hormone-based mechanisms that can actually pass through that barrier. And we know that when your microbiome changes, not only does it affect your physiology, all the things that we're talking about here, but it also affects your cognitive function, which affects your behavior. So, sure, we need to have good cognitive behavioral skills to help our patients and clients. But if we're not optimizing nutrition and making sure that our brain is fueled with the micro and macronutrients that it needs, it actually changes the behavior of the organism, which is us, the individual. So those are the four ways that I like to kind of really simplify this as much as possible for clinicians, so they start to really understand, kind of what's happening here. Now, the question I often get is, okay, well, Joe, what's the best diet for osteoarthritis? What's the best diet for rheumatoid arthritis? What's the best diet for CRPS? And it's really not a question of what's the best diet, right? Because even if we found through evidence that there's one best diet for a certain condition, people sometimes can have challenges with adhering to these healthy patterns of eating. So I think the better question is, Rose, how do we help our clients or our patients adhere to all these healthy patterns of eating? So whether it's a Mediterranean diet, or whether it's a paleo diet, or whether it's a paleo autoimmune diet, right? Kind of the steps, that's not too difficult. People see the steps. Okay, I need to take out sugar. I got that. I know that sugar's not good. Or I need to take dairy out of my diet for a period of time and see how that affects my joint health. Okay, I understand that. I know where dairy is. But please help me as the patient. How can you help me adhere to this? Because this can be really difficult when we live in a world that says that dairy is healthy, that you have to have dairy for calcium, and we know those two things are not true, right? For some people, dairy is not healthy, and you can find calcium in lots of different types of food, specifically green leafy vegetables, right? But the question is, how do we adhere? So I want to turn it over to Rose, who's going to help you answer, questions like, or help your clients actually answer these questions, like why is improving nutrition important to you? If you decide to change your eating habits, how would you begin? If you decide to make a change in your eating habits, what would be the most important reason for you to do that, right? These are all techniques we have for helping people enhance their motivation. So, Rose, I'm going to turn this over to Rose Pignataro, my good friend and colleague. Rose is a professor in the Doctor of Physical Therapy program at Emory and Henry University in Virginia. She has obviously a doctorate degree in physical therapy. She also has a PhD that focuses on health behavior change and enhancing motivation, which is why I have her here today to speak and share all this great information with you. So without further ado, thanks for being here, Rose. I'm going to let you take over the controls.
Let's see if I could share my screen. Thanks so much, Joe. Here we go. All righty. So thank you so much, Joe, for inviting me, and thank you everybody for joining me today. Hopefully you can see my slides. I think you can. Um, so Joe was talking a lot about how nutrition affects pain and other physiological functions, and it's not always something that we intuitively know. And so, if we don't intuitively know it as clinicians, then it's often difficult for our patients to appreciate the benefits of nutritional change. And not only the perceived benefits of nutritional changes, but the importance of nutritional changes. And so, that's where motivational interviewing really comes in handy as a skill for us. Motivational interviewing sometimes is misinterpreted as it's not really an interview as much as it is the intention behind the types of dialogues or conversations that we engage in with our colleagues and with our patients, with the people around us. That intentional conversation can be designed to explore the factors that influence our behavioral choices. Also, when we are talking about perceived benefits and perceived importance of nutritional changes with our clients, we can use motivational interviewing to explore discrepancies between their behaviors as they stand now and the patient's personal goals and values. And so when Joe is talking about the importance of nutritional changes, how does the importance of nutritional changes fit with what this person hopes to accomplish in their lives? As we are talking about those nutritional changes, we can have knowledge of what a proper diet looks like and not be able to implement it. And so, motivational interviewing also helps us to speak with our clients and learn more about their perceptions regarding what makes it easier and what makes it more difficult for them to engage in these types of nutritional changes from a long term perspective. Also, motivational interviewing is very assets based. So it emphasizes the strengths of an individual rather than a more pathological mindset where we're looking at impairments and how to correct impairments. Here we're talking about what's this person's strengths and how do we leverage those strengths. And so Joe was mentioning some cultural preferences for foods and cultural diets. That can be a big asset. There are lots of healthy recipes and traditional ways of eating, like the Mediterranean diet, for instance, that can be a strength-based asset in facilitating these types of long-term nutritional changes. So in essence, motivational interviewing is really about the way that we have conversations. It's a bi-directional dialogue. If we're doing motivational interviewing well, it's really the client that does more of the speaking. And so they take the spotlight, so to speak, during the conversation. And it's what we do ourselves as clinicians in terms of asking the right questions or helping the person by emphasizing certain aspects of the dialogue to recognize what their assets are, what the discrepancies are, and making them the expert. By putting them in the spotlight, what you're doing is asking the patient to identify the best strategies, which are really important when you're talking about some type of individualized choice like diet. What are the best choices for this individual? What's going to be feasible and realistic in terms of implementing this on a long-term basis? So we're really emphasizing shared decision making. As a clinician, I certainly have lots of expertise, and motivational interviewing doesn't preclude me from offering advice or recommendations to the patient. But what it does is allows the patient the freedom to make decisions for themselves. I'm emphasizing the fact that I can offer recommendations for sure based on my clinical experience, but that person is the expert in their own lives. So they have to be free to let me know what's going to work for them and what isn't. So authenticity and honesty then becomes a really important factor. We're empowering the patient to make these choices based on theoretical information from self-determination theory, right? Human beings, especially when we're working with adults, but even children, we are determined to make choices on our own. We're very self-directed, and there's nothing wrong with that. It's actually an asset. Also, when we're working with people who have chronic pain, a lot of times it affects our perceptions of ourselves. So it can affect our confidence in the ability to take control of our health, right? And when I talk about the case study in a little bit, what happens is that the way that our healthcare system is set up is that a lot of times the person is receiving care, but they're not necessarily taking an active role in choosing different types of interventions and giving feedback about whether or not those interventions are going to work for them. And so they lose confidence in their ability to manage their own health. Using motivational interviewing helps increase self-efficacy or the confidence in your ability to make good choices and enact those good choices in your day-to-day life. And by doing that, we're facilitating a restoration of independence or autonomy. Also, in terms of what's realistic and feasible, that collaborative intervention planning or treatment planning and follow-up really allows us to create tailored, personalized strategies. So as Joe was mentioning before, dairy, for instance, right? Some people do well obtaining calcium from milk products or yogurt, cheeses, and some people don't do well with that at all. And so by allowing the patient to provide us with feedback, maybe you start eliminating or adding in certain aspects of nutrition, and then the patient tells us what's working and what's not working. Additional benefits of motivational interviewing is that a lot of times people who have chronic pain or neuromuscular, musculoskeletal disorders or impairments sometimes get labeled, right? They're pains, they're drug seeking, they're malingering, they're symptom magnifiers. And so it's really important for us to use a conversational technique that allows us to provide feedback in a non-judgmental manner, right? We're showing that we're collaborating. We're not judging you in any way. In fact, if we are judging you, it's in a positive light where you are free to tell us what's working and what's not working. The other thing is that the way motivational interviewing is designed is that it was originally used to address substance use disorders. And what they found in the process of doing that research is that it actually works best when we're most resistant to change. And all of us like our routines. And so everybody, it's human nature to be resistant to change. We need to explore with our patients the reasons why they might be resistant. Maybe they have a low awareness of, again, back to those perceived benefits and perceived importance of nutritional changes. Maybe they have a low desire, right? If I don't think it's important, then it's not worth my effort. Maybe the benefits aren't clear, or the person thinks that this might be a really great idea, but I just don't have the confidence in myself to be able to take action. And the other thing is, I love this meme, but maybe it doesn't seem that bad, right? You've heard the analogy of the frog in the boiling water. If everything around you, so chronic pain can develop gradually over time, right? And our nutritional habits can also deteriorate over time. So maybe we don't have a good perception of the way the status quo is actually having an adverse effect on the things that we value most. And so it's not fine. How do we help people just develop that discrepancy between what they hope to achieve and what's going on right now? It also lets us take a broad view of what's happening with the patient beyond just the physical impairments. So, what are the contextual behavioral influences? By asking the open-ended questions that Joe was posing before, how do I get a better idea of what types of information does this patient need in order to be successful, right? So, what cognitive factors are involved? What types of emotional factors are involved? Because a lot of people have emotions that are associated with food, our food intake, and our food choices. What types of psychological factors like mood dysphoria, mood dysregulation, which is very common in people who experience chronic pain, and how do those factors influence our behavioral choices? Social factors. Eating is a social event, right? And so very often we're eating with other people, or it's the way that we relate to each other, right? I come from an Italian and Latin background. You don't tell my mother that you're not hungry because she doesn't care. You're eating anyway. So that's a social influence. And then environmental influences. What type of food is available? And so very often we'll make recommendations, but if that food is not available in the person's environment, how is that going to be feasible for them, especially in the long term? Motivational interviewing has something called the spirit of motivational interviewing, which basically describes the elements that support the use of this type of conversational technique. And I mentioned before how collaboration is so important. Very often there's an accusatory tone, or there might be an implied or perceived accusatory tone or a judgmental tone when we're giving patients advice, right? If I'm giving you a recommendation, it means that what you're doing right now is wrong. And so as soon as I give this perception that I think you're wrong, we have more of a confrontational type of or adversarial relationship versus that collaborative relationship that I'm striving for. Words matter, right? And so when we say that a patient is non-compliant or non-adherent, that means that I told you what to do and you refuse to do it. Instead, I like the word concordance because when we're in concordance with one another, it means that we've actively sought to come to a point of agreement. You've provided your perspectives, I've given feedback, I've helped guide you, and together we've come to this plan that's going to allow you this long-term change in your behavior. It also uses a less directive tone, and so we're supporting autonomy versus using an authoritative approach. We are helping support choice and self-direction for this person that has been basically disempowered by the chronic pain experience and maybe their previous interactions with other types of healthcare providers. And then finally, there's the spirit of evocation. Basically, where self-determination says that people, human beings, have the inherent capacity for behavioral change, right? We're not stagnant. We don't stay the same. Also, we believe that each person knows what's best for them. So if we can evoke that, if we could allow the person to recognize this inherent knowledge and bring that about in a way that is actionable, then we have a better chance of success. And finally, if I'm showing as a clinician that I strongly believe that you have the ability to change, then that's a model for the patient's own self-efficacy. As we are looking at empowerment, some of the things that we have to look at is that being empowered allows behavioral activation and it increases intrinsic motivation. I'm not coming home with you. And so if you don't truly believe within yourself that this is something achievable or attainable, then it's not going to happen. It reduces feelings of vulnerability and it opens pathways to resilience. This person may have been labeled with an incurable illness. And when we say something is incurable, and then we send someone to a physical therapist or other type of professional to promote recovery, those two things don't go together. So if I say something is incurable, where's the resilience in that? Right? You become very vulnerable when somebody has labeled you with an incurable or even a chronic illness. How do we change that by becoming more resilient, being able to bounce back? And it ignites or restores positive outcome expectations. And so, if we are helping somebody with long term change, I have to have the belief that this is going to turn into something that matters, right? I'm not going to go through all this effort if I don't think it's worth it in the end. The other thing is that we have to look at the importance of collaborative dialogue from the perspective of how we've been trained or maybe how we've practiced over time. And so I saw before in the chat that there is somebody with us who's been working with the chronic pain population for over 30 years. That is me as well. And the way that I was trained is that I'm the expert. I'm going to tell you what I think works, what I know works based on my experience. And so wanting to help, it's not a bad thing to want to help, but it can make us overly directive, which motivational interviewing practitioners call our writing reflex, our tendency to want to make things right. But if I emphasize what I think is right, it's going to provoke resistance, as it should, right? If I tell Dr. Tatta, Joe, this is what you need to do, without asking him what he's already tried or what he knows does and doesn't work for him, then we're going to butt heads. So we might unintentionally provoke what's called sustained talk. Now Joe is in a position where he needs to defend himself and explain to me why what he's already tried or what I'm recommending won't work. So instead, we emphasize the person's right to choose and we make the person aware that we're expecting them to be somewhat resistant. Resistance is human nature and it is a natural part of this change process. It also gives us an opportunity to view lapses in behavior differently. It's not a failure, it's a learning opportunity. What you're doing is gathering more information about what hasn't worked in the past so that we can tweak it into something that does work better. We also have to think about the fact that self-examination as a clinician is very important. I need to be able to reflect on my own ability to communicate. And I need to have the confidence to be wrong. If a patient tells me, I tried that and it doesn't work, okay, maybe it worked for the last 99 patients that I worked with, but if it doesn't work with this person, then it's not the right intervention. So we have to allow the patient to be, or the client to be able to correct us. Also, you've heard the phrase, we talk ourselves into something. There's a real basis to that. You are more likely to be persuaded by what you hear yourself say versus what somebody else tells you to do. Right? There are actually two phases of motivational interviewing. So again, this is more of an intentional form of conversation than it is an actual interview. But what I say matters to the client. I'm eliciting change talk, so I'm emphasizing things that they say about their desire for change, why the status quo isn't working for them. I'm really emphasizing their ability to change. Anything that they say that sounds like a belief in their ability to enact this new behavior is something I really want to emphasize. What are their reasons for change? And again, this is personalized, and the need for change. And then the second phase is to be able to promote commitment to this new plan of action. Commitment, behavioral activation, and then actionable steps. How are they going to implement this in real life? All right. So I want to talk a little bit about, and I do have his permission. So, I have not revealed any information that would violate HIPAA, but nonetheless, in the spirit of collaboration, I think it's important to let our clients know when we are speaking about them behind their backs. And I am speaking about this particular client because he amazes me, and together in our relationship, there's been bidirectional learning. I've certainly learned just as much from him as he has learned from me, hopefully. And so I wanted to talk a little bit about how the two of us use motivational interviewing to change some of our perceptions. And so this is not his x-ray necessarily, but the client that I'm talking about has ankylosing spondylitis, which is an autoimmune condition. So first of all, when he heard autoimmune condition, he interpreted that as my body is attacking itself, so somehow I'm at fault. Okay, so that's the first thing. Words matter. The second thing is that ankylosing spondylitis is incurable. Okay, and so with that came this whole body of psycho-emotional upset. I'm relatively young. I have these life goals that I'm not going to be able to achieve because I have this degenerative, incurable illness. So nothing else matters. My actions no longer matter. My role perception, my self-esteem has been completely damaged by the fact that however I saw myself previous to this diagnosis has to be changed because I have this condition. Okay. And the other thing I want to mention is the importance of interprofessional collaboration because this client actually came to me as a physical therapist through a clinical mental health counselor. And so, again, the importance of recognizing the close ties between our psycho-emotional wellness and our physical wellness. And so, one of the first things that we talked about is the label ankylosing spondylitis and what he had been told about it. And so some of the things that we had to consider is that he was told that he he had this incurable illness, and yet the physical therapist is going to help you with recovery. So there's our first discrepancy. Also, he was told that his main treatment option was prescription medications. So now we have somebody dictating what you need to do with your life. You need to take lifelong prescription medications, disease modifying anti-rheumatic drugs. So his power of choice has been taken away. And he has low outcome expectations, right? Why are you sending me to the PT if this is incurable? He's had major damage to his self-image, loss of independence, change in role perceptions, and then because there's this perceived lack of control, he's become extremely anxious, which is why he sought out the clinical mental health professional, because the anxiety in not being able to control the outcomes of your life became overwhelming to him. And so thankfully, this clinical mental health person and myself know each other pretty well and send clients back and forth so that we can have this holistic perspective and holistic plan of care. We support people the best that we can. So, in terms of what this person's goals were in coming to see me, well, I can't cure you're right. I can't cure your ankylosing spondylitis. I'm not going to get rid of the disease, but you tell me how this disease has impacted your life. And in terms of the impact of this condition, what's the most important things? In terms of your personal goals, what's most important to you at this point in your life? Okay. And then based on those goals, what's possible? What's feasible? Because when we say recovery is impossible, no, recovery and cure are two different things, right? Recovery is the ability to attain the goals that I've set for myself myself. And I can do that even if I have this underlying physical impairment. So we talked about what can be changed. And as somebody who works in health promotion, we put emphasis on the modifiable behavioral factors. And we talked about the big five, leading off with nutrition, exercise, sleep, stress reduction, and substance use, which gets a bad rap. But caffeine is substance use, which I'm engaging in right now. And so caffeine affects ankylosing spondylitis, which is something that this person was not aware of. Caffeine is a powerful vasoconstrictor. And now we're talking about an inflammatory process to an area of the body that already has suboptimal circulation. So is that something that we need to consider? And so we focused in on nutrition. That collaborative approach to concordance allowed us to prioritize goals. From this person's perspective, from this client's perspective, the thing that seemed easiest to him in the moment was to alter his diet. And so that's where we started talking about what are the benefits in terms of chronic pain management and restoring function that could come from changes in diet, and what types of changes in diet would be best in in the context of this person's life. Also, when we're talking about nutritional changes, I wanted to put the emphasis on behaviors versus outcomes. And so the first thing he talked about from a nutritional standpoint was the need to lose weight. And I'm not negating that, but if I say somebody's going to lose 15 pounds, that is an objective outcome, but it's controlled by behavior. And weight loss is sometimes controlled by other things besides our behavior. What types of medication are you taking? If they put this patient on corticosteroids, which they did, is that going to cause an increase in his weight that's not related to his behavioral choices? And so we're focused on behavior. So what's his dietary choices? Also, we had to talk about regaining function or restoration of function versus total elimination of pain, because we are expecting the nutritional changes to modulate pain, but because of the structural changes in the spine, it's likely that there is always going to be some underlying pain. And so if I start saying that you're going to be completely pain-free, then I'm going to lose credibility because I can't guarantee that. The next thing that we did was use standardized measures for planning the best strategy to meet the goals. And also, as a clinician, those standardized measures then give me a baseline to see, are we making progress, right? And it gives the patient a baseline as well, because I like people to be able to self-monitor. And so when we talked about self-monitoring, what the patient said, because he also comes from a research background, is, oh, Rose, I'm going to be my own guinea pig, which to me sounded awful, but to him, this was a great thing. He got to be his own case study, which I loved because, yes, now you're playing an active role. You're going to play an active role in taking the baseline measurements. You're going to take an active role in using those baseline measurements to plan our intervention, and then also being able to compare outcomes at certain intervals within our interactions to what's going on before and what's happening now. So that became really important. So the standardized outcome measure that we used is a food choice questionnaire, or FCQ. And that uses certain statements to find out what's most important to people in terms of their nutritional choices. So do you make nutritional choices based on health concerns, based on your mood, based on convenience, based on sensory appeal, the natural content of the food, the price, being able to control weight, familiarity, right? Certain people eat the same things over and over. Or do you make, or it could be multiple things. Do you make your food choices based on ethical concerns? So sometimes you might see this for people who only eat organic, or perhaps they're vegetarians or vegans. And so that allows us insight into what's this person's values and how do we use those values as assets. And so what we found out from this patient or client was that his health, right? That was the first thing that we were talking about. How am I improving my health? And in terms of health, we were more focused on function versus pain modulation, although they do go hand in hand, and we recognize that. Mood, not so much, but convenience was a big thing. Single gentleman, right? He doesn't want to go through a lot of trouble to cook for himself. And so very often his food choices are um, dictated or not dictated, but influenced by convenience. And then sensory appeal. He was a foodie. He is a foodie. So I've actually gotten recipes from this client. That's another advantage of bidirectional dialogue. And so sensory appeal was a really big thing. How does this taste, basically? And so we use this collaborative approach to, first of all, identify what matters in terms of choice, and then how confident is he in his ability to make a choice that's going to lead him towards the goals that are important. And we use the 0 to 10, a basic 0 to 10 scale for to rate confidence and chart that confidence over time. How confident are you that the plan that we've created together, including SMART goals, including perceived, so we talked about perceived barriers and perceived facilitators, what makes this easier, what makes this harder? How confident are you in this point in time and being able to enact this change? And if the person gives a high number, that's great, right? That gives us an opportunity to affirm their strengths. But if they give a low number, that also advances our conversation because I can say 3, okay, well, 3 is bigger than 0, first of all. And so what might it take to take you from a 3 to maybe a 5 or a 6? We also, in our action plan, created affirmations, right? I'm somebody who appreciates food with good taste. Food with good taste can also be healthy for me. All right. I'm capable of doing this. I've done hard things in the past. And so I am resilient. And now I'm taking that resilience and I'm moving it forward to take better control of my health in terms of the outcomes from this quote unquote incurable disease. What types of additional support or resources are out there? And so I have resources that might work for the patient, but the patient can also search resources. Okay, so he had self-identified support through the American Spondylitis Association, and then he found this website which has all types of conditions on it. It's called Patients Like Me, and it's free, and people can register and have online discussions and access resources, including nutritional resources that help them make behavioral changes. And this finally is Sir Albert Einstein. And Einstein is a major component of this person's support because not only for proper nutrition, because we can't feed Einstein table scraps that would harm his health. And so we don't eat things that can harm my health or his health or Einstein's health. And Einstein also encourages physical activity and gives this person a reason to get better because Einstein likes to walk. And so Einstein, I don't normally include dogs in my plan of care. Um, but in this case, we certainly could do that based on what I learned through motivational interviewing. The other thing is that this patient, we talked about some of his hobbies. So, how does he occupy his time outside of work? What matters to him from a social perspective? And he took this label of bamboo spine that is attributed to ankylosing spondylitis, and we talked about, what does it mean to be bamboo, right? And we talk about ankylosing spondylitis. It's rigid, it's inflexible, but in fact, bamboo is very flexible, and bamboo is actually really resilient. And so he did research and started talking to me about bonsai trees that are made from bamboo and how that bonsai tree can be shaped to the person's will, the gardener's will, with patience and also direction, right? Self-direction in this case, but bamboo is flexible, bending with the wind, never breaking, capable of adapting. It suggests resilience, which is exactly what he and I were talking about using motivational interviewing. So even in the most difficult times, as human beings, we have the capacity to bounce back. So I'm handing it back over to you. It's like a tag team.
Okay, if you have questions for Rose, we're going to head to Q&A in just a moment. If you have questions for Rose, you can pop them into the chat thread. We will read through those and take a look at those. And I think, within, what was that, maybe 30 minutes, I think you can really see how incredible the incredible resource that Rose Pignataro is in this area of motivational, enhancing motivation, as I like to say. I do encourage you to work directly with Rose. She has a course here at the Integrative Pain Science Institute on motivational interviewing for chronic pain, where she goes much, much deeper into all these topics, where you can learn that collaborative, patient-centered approach to health behavior change in all the areas of exercise, physical activity, substance use, sleep, stress reduction, right? That's 7 CEUs. It's available for physical therapists and physical therapist assistants and any other health provider for just $449. If you have no background in nutrition and you're looking for nutrition training, most of you probably know I have a certification in functional nutrition for chronic pain. It was one of the very first courses that I created. It's been out there for some time now, where I teach you a variety of different healthy patterns of eating that help to reduce pain and or treat non-communicable diseases, right? Kind of those bidirectional associations. It's a bit of a deeper course. It's 36 hours, so 36 CEUs for $997. Now, obviously, Rose and I are here together because we know that motivational interviewing goes well with nutrition changes. You have to have these two skills essentially. You can't just understand the nutrition science without having the skills to help people sustain the behavior change. And just because you understand how to sustain health behavior change, you also have to know how to answer people's questions when they ask you things like, well, is a paleo diet or a Mediterranean diet better for me? Which one? Right? So you need the nutrition science as well. If you sign up for both of those today, we are offering the courses together in a bundle where you'll save 30% on the cost of both. That's what we're recommending today. We really think that you need both of these skills to start to enhance the motivation and sustain what people need as far as nutrition change goes. And I'm going to pop that into the chat thread for you so you can click on those links. You can read about the bundle there where you'll save 30%. Or if you'd like, you can purchase one course at a time. So just the MI course or the nutrition course. I recommend the bundle because obviously you can, once you have these courses, they're yours, they're in your portfolio for the life of the Institute, and you can come back to them time and time again, whether you come back to the nutrition information or you come back to the MI information. This is learn as you go, so they are asynchronous courses. You can take your time, you can go through it at your own pace. We really make things pretty easy for people here at the Integrative Pain Science Institute because we understand that you're busy professionals and you have a lot of things going on, right? So with that, those links are there. We're happy to answer any questions you have about the motivational interviewing course or the functional nutrition course or the bundle that goes together. And I do see one question. Maybe we'll start kind of with the one question here. So Sarah asks, is there a length of time or a time frame that we can tell our patients that they may expect to see a reduction in pain once they establish a consistent, healthy pattern of eating, right? Yeah, people do have questions like, how long will this take, right? That's a normal question. I'll answer that first, and then I'm going to turn it over to Rose to give her input as well. So here's how I approach this. If you're working with someone, like let's say you're working through an elimination diet with them, and you're eliminating, let's say you eliminate dairy the first week, and maybe you get lucky in that first week, you realize that, wow, this person actually has an intolerance to dairy. And once you eliminate that food, within about 4 to 7 days, if someone has a very specific food intolerance, right? So let's say they have a very specific food intolerance to one food. Within 4 to 7 days, they will notice a change because you're talking about the mechanism there is the specific food intolerance. Okay. So it could happen in as short as 4 to 7 days. If it's just that their overall pattern of eating is so poor and nutrient, void of healthy nutrients, right? So void of the omega-3 fatty acids, void of fiber, which is detoxifying for the body. Maybe they're missing some, key micronutrients like calcium or magnesium, which are important. Maybe it's just that they have prediabetes or diabetes, and we really need to bring down obviously their blood sugar, right? Something like that takes a little bit longer, but they can still see changes. I say with those types of like, you're looking at a big metabolic shift. A metabolic shift takes a little bit more time, usually between 3 or 4 weeks. If they're adherent to it, they start to see changes there in their pain, obviously. Rose, you want to answer anything there?
Yeah, that's a really great question. I think my answer is a little bit different than yours, Joe, is because more so have using the motivational interviewing have more of a functional focus. And so one of the other instruments I use is the patient-specific functional scale. And so I use that scale to have the patient rate where they are now in terms of their most important ability to function and where they'd like to be. And then we use that as a way of charting whether or not we are making improvements. And we also use that to create a very personalized, tailored action plan. And usually we do 2 week action plans. And so within that 2 weeks, we're going to do a follow up to see whether or not their function has improved. And as their function improves and they notice that change in function, sometimes they'll also notice a change in their pain level. And so we do create actionable items on a 2 week basis and revisit their function and their pain. But
We also know that some of you have taken one or maybe more of these courses. You're actually already in these courses and you're learning. If you have questions, you can also raise your hand. I can come over and unmute you, and we can talk, obviously, one on one, or you can just pop a question into the chat thread there. We're happy. If you raise your hand, I'll see it on the screen here, and I'll come over and unmute you so we can talk. And just so you know, so those two courses are there. The 30% discount on the bundle is good for about a week. After Saturday, we'll close that offer. So if you're interested in that offer, sometime between now and Saturday is the window to take advantage of that. So Lauren asks, how much of this information is integrated in the mental health physical therapist certification? The answer to that is practically none. That is a completely all my courses are distinct and different. You're not going to find almost any overlap in any of the courses. Yeah, we're not repeating information here. If someone has a master's in functional nutrition, do I recommend the course? I do, because what I found is that nutrition for pain is rarely a part of dietitian training, and it's really rarely part of even master's level um, uh, nutritionists as well. Yeah. Anyone else want to chat with us or have a question for us before we wrap up and let you enjoy your weekend? Rose and I thank you for being here. We are going to do monthly webinars for 2025. So you're going to see emails from me and social media posts about lots of different topics, not just MI and not just pain. We're going to cover lots of different topics. So about once a month, you can join us in this kind of community atmosphere and learn a little something. Obviously, some of you may already be accessing this information in the courses from the Integrative Pain Science Institute. And we also love to hear from you. So we welcome any emails and questions. And actually, I should just pull that back up for 1 second. Hold on. If you have questions or comments for Rose or I, these are just some testimonials. I think you guys know I've been doing this now for, good decade. Lots of good testimonials from people. If you want to reach out to us directly, you can reach out to Rose at rpignataro@emoryhenry.edu. And most of you know you can find me, Joe, or support at integrativepainscienceinstitute.com. So we're happy to communicate with you. Any further questions about anything we spoke about today as far as the content of our webinar or the MI course or the nutrition course?
Joe, I just wanted to thank everybody for participating. I teach doctor of physical therapy students, and I love them to pieces, but it's always a privilege to be able to speak with colleagues.
Yeah, it is. All right, everyone. We are right on time. We said this would be about an hour webinar. So we appreciate all you being here, and we look forward to learning and growing with you over the course of the next year with this webinar series and in the courses as well. Any questions? Feel free to reach out to us. If not, I wish you lots of love, and we'll see you in about a month on the next webinar. Thank you, everyone. Take care.
Thank you.